When I was in high school, I had to choose between being a dentist and being a pilot. I was like 15, 16 years old at the time. I said, well, being a dentist will not be an obstacle for me to be a pilot as well. But being a pilot, I cannot be a dentist then.
Right. That does make sense.
Exactly. The feedback I receive is very, very positive. I see people being happy of being here and following the scientific program,
right.
Meeting people from other countries.
Different continents.
Different continents. You mentioned the teamwork, the great teamwork to organize an international conference. That was a very difficult task, but it was very challenging and very fulfilling because me from Greece, John from Ireland, Fiona from Scotland, Sophie from Paris, Stavros from Germany.
Right.
One thing I don't like about Greece is that I realize that many times Greeks do not see their potential. The world we're living in today, you can have interaction from all over the world.
Absolutely. And we are a good example of that.
We are a very good example.
Exactly.
Welcome back to the channel, everyone. Episode 46 of the MADtherapy Sessions podcast is here. Last month, I was in Edinburgh for the European Association Sports Dentistry Conference, where I finally got a chance to meet Dr. Thanos Stamos. He's the co-founder and the executive vice president of the European Association for Sports Dentistry and chair of the European College of Sports and Exercise Physicians Sports Dentistry Committee. The podcast is also available on Spotify and the YouTube Music app. The links will be in the description down below. Enjoy the episode.
Dr. Thanos, good morning. Welcome to the MADtherapy Sessions podcast. It's a special guest in a special place, and of course with a special guest, Dr. Thanos Stamos. And I would like to, formally welcome you to the podcast. We have been talking about it since quite some time, and finally we meet, and it's such a beautiful place. How's the Sports Dentistry Conference going, according to you, Doc?
Thank you, Arib. First of all, it's an honor and pleasure to meet you finally in person because we've been in communication since a long time.
Right.
And we finally make it to meet and in this beautiful Edinburgh and this beautiful stadium here in Murrayfield. My first impression from the conference is that I'm very, very excited, very, very happy to see all the people traveling here to attend the conference. And the feedback I receive is very, very positive.
Right.
I see people being happy of being here and following the scientific program,
right.
Meeting people from other countries.
Different continents.
Different continents even.
Yes.
So this gives me a great pleasure.
And it's all because of you, John, Fiona, and the entire team at the European Association. And you guys must be very proud at what you guys have achieved, and it's not easy. It's like you said yesterday. It's taken 10 years to build this entire thing.
Yeah, we started literally from zero. We had the vision of creating something in Europe, but not just for Europe. And even though at the beginning we were just 6 dentists in.
So this was way back in 2000?
Yes, 2014.
Okay, so it's almost 9 years back.
9 years back.
9 years back.
Yes. So we were just 6 dentists that from different countries. We had this vision, we had this idea, and we finally decided that the best way to do it is to just do it. So here we are now after 10 years. You mentioned the teamwork, the great teamwork that we did to organize an international conference of sports dentistry, which is at the same time unique and the biggest in Europe ever organized. And that was a very difficult task, but it was very challenging and very fulfilling because me from Greece, John from Ireland, Fiona from Scotland, Sophie from Paris, Stavros from Germany.
Right.
I might forget a lot of names, but you see that from different countries, we could organize a conference in Edinburgh, and this is what we do in all the projects so far, and this is great.
That's like, it's a perfect example of, starting something what you believe in, and then, going at it. And then of course it took time, but now after say like 9 years, you can be proud of the legacy you have created. And it's just the start.
It's just the start, but it's also what we learn from sports. This is sports, right?
Right.
You have to work hard to achieve your goals. You have to work together with your colleagues as a team. because Michael Jordan said that talent wins games,
Right.
but the teamwork wins championships.
Yes.
So this is the spirit of sports, and this is the spirit what we have also in the sports dentistry.
So, Doc, how did you get into sports dentistry? As in, when did you start thinking about, or were you always interested in this?
Not always. 15 years ago, more than 15 years ago, by chance I had some professional football players in my office. So I realized that I cannot really implement the diagnostic and treatment protocols that I implement to everyday patients.
Right.
So there were many restrictions, many limitations. And also from epidemiologic point of view, it was a bad situation from epidemiologic point of view. So I realized that we have a special group of patients that we need to take care. I always believed, though, that dentistry or medicine should adapt on the patient and not the opposite.
Wow.
Every patient is unique. You cannot apply the same protocol to all patients. You won't succeed. So you need somehow to examine an individual and see what exactly you need to do in therapeutical terms. And this came up, and then I started to think about this special section of dentistry, and I was really happy because after a while I found other dentists with the same interest in Europe and beyond, and that's how it came up, the idea of sports dentistry.
Wow. And that's one thing which people don't realize is an athlete's teeth and oral health is completely different than a normal average person's teeth, and their requirement, their oral needs are completely different than what we see on a daily basis. And so that hence the requirement for a sports dentist, right?
Yeah, we have differences in terms of pathologies. We usually find in athletes more pathologies statistically than in an average person, and especially in young ages. The second characteristic is that the athletes submit the whole body into a great pressure from exercising, and the stomatognathing system cannot be an exception. So as much as they exercise their muscles, the stomatognathing system and the function of the mouth is also influenced. So this is what we have to take into account.
And it's been almost say 9 years now, 9 years into sports dentistry. And what are the things you have learned along the way as a sports dentist? What are the changes you have seen, in the last 9 years in sports dentistry?
I've seen a lot of changes. I have to tell you that 10 years ago, when somebody was saying sports dentist or sports dentistry, that was a kind of a joke, honestly, even within the dental community. I've seen many incredible things happening. The first that comes to my mind is that 4 years ago, the World Dental Federation, for the first time, the FDI gave an official definition in sports dentistry, and also recognized the need for a publication of official guidelines addressed to all dentists all over the world.
Right.
This was a great thing. The second is that now the dental community, the international dentistry community, started to embrace sports dentistry and start to realize what is the need of having such a specialty, because, in my opinion, it can be a specialty. And the third thing, what I see happening all these years is that I see, and this is very important, both sports medicine and sports physicians and the athletes to see more, to look after the oral health, and this is a great achievement of sports dentists so far.
I mean, that's one thing which a lot of people ask me personally is, what is a sports dentist? Like you said, people did not know what is that, and now people do know what is a sports dentist. And even the third point, what you mentioned is, athletes have started, taking their oral health, giving importance to oral health, because now they can see the improvement in their performance if they take care of their oral health.
Yes.
And I think that's the biggest role of a sports dentist, and the biggest win for any of us is to convince an athlete to take care of the oral health.
It's a very good remark what you just said, and I believe the greatest value of sports dentistry is that we have to realize that there is a two-way connection between oral health and overall health. In sports, particularly, bad oral health can influence the performance or the overall health, because we care first about the overall health and then for performance.
Right.
But also the sports itself can influence the oral health. And this is a two-way relationship.
Absolutely.
And within this context, the great value of a sports dentist is to realize that whatever is doing in the oral cavity, from fillings to periodontal surgeries to prosthetic work or anything, has a greater impact on the rest of the body than we initially thought. And even in the past, we were saying, all the dentists were saying that, okay, whatever we do has an impact. This impact now, we can measure it. There is a lot of research and scientific evidence out there now over the last 10 years, and I believe it's thanks to sports dentistry, that we have visible examples
Right.
of our work as a dentist has an impact on the rest of the body.
And research is increasing. A lot of data is getting documented. Like right now in the conference, we are seeing a lot of dentists from different parts of Europe are, like even yours, like a research what you did in Greece with the footballers has been documented, and that's great. I mean, when you have document, when you have data, you can back it up, with scientific evidence.
Exactly.
So, Doc, I wanted to ask you is, how did you get into dentistry? As in, this was the sports dentistry part, but what made you join dentistry as a career, as a profession?
Well, I guess because we have a lot of gadgets to play, a lot of instruments, and a lot of equipment.
Okay.
When I was in high school, I had to choose between being a dentist and being a pilot. So when I was young.
So are you happy you became a dentist and not a pilot?
Yes, I'm happy. Then
Okay.
how I made my choice is that I remember my father coming and asking me finally, what do you want to do in your life? You want to be a pilot or you want to be a dentist? So I said, I will be a dentist. He said, well, how come? I said, because I was like 15, 16 years old at the time. I said, well, being a dentist will not be an obstacle for me to be a pilot as well. But being a pilot, I cannot be a dentist then.
Right. I mean,
Right.
yeah, that does make sense.
Exactly.
Yeah.
So I became a dentist, and when I was a student, I started to like it more and more. I still had the idea that one day I want to take courses so that I can fly a plane.
So have you?
No.
Okay. Do you plan to?
You never know. Yes.
Do you plan to go into aviation?
Yes, probably. You know,
Okay.
to have a license to fly small planes. This is very interesting, the aviation. That was the reason.
Very similar to dentistry, like a lot of precision, a lot of gadgets, like you said.
Exactly. Those are things that I didn't know when I was before I entered the school, dental school. But then I realized that this is a much more difficult specialty than I thought.
Right.
You need a lot of precision. The second thing is that you need to work in a very close proximity to the main sensors of the human body, which is the eyes, the nose, the ears. It's not easy for us, a dentist, to work right in front of face of somebody looking at us like terrified. So, and we need to deal with many things at the same time.
Right.
And I think this is great. And of course, if you consider that the development of dentistry over the last years give us all these gadgets and all these instruments and equipment that they can make every dentist happy.
So you enjoyed your DDS program?
Yes.
Okay. And then you further went into McGill University for your advanced dentistry, if I'm
Yes.
not wrong?
Yes. I went for postgraduate studies and at McGill University in Canada. That was an incredible experience. I enjoyed both the place and the faculty there. There I realized that when you finish your studies and then you go for a postgraduate and you do you're working in a hospital environment, then you go into real life of dentist,
right.
It's not you go out from this a nice environment of student, and then you realize that it's a hard profession, and you need to take the best possible decisions for your patients, and this is where you become a real dentist. I mean, like the experience you acquire after the school, dental school.
Absolutely. So, looking back, do you think are there any things which you should have done, which you did not do in your DDS days or McGill University? Are there things which you not say regret, but now if you look back at your dental journey, do you think you should have done this more or done that more or something like that? Have you ever given a thought?
Not really.
Okay.
Not really.
Okay.
I really enjoyed all the way, both my studies and after my studies when I started my clinic in Athens. That was never easy. That was not always easy. But that was a journey that I enjoyed, and thinking back, I think I wouldn't change anything.
So, when you went back to Athens, started Excel Dental.
Yes.
And how did you decide to put your own private practice, and what were the key factors you envisioned in when you putting your own clinic?
I went back to Greece, and then I had to start working as a dentist. Hospital environments in Greece are not favorable for dentistry.
Okay.
I mean, we do have private and public hospitals that have dental clinics, but most of the profession is exercised by private dentists. The thing what I didn't like, and I still don't like, is that the way we exercise dentistry in Greece is very, very individual. Individual.
Okay.
You don't see the clinics as you see in the other countries.
Okay.
Dentists working together, 5, 10 more dentists.
Okay,
opening
got
clinic.
it.
It's very
not
individual.
Not like a team oriented. It's
Exactly.
more individual based.
Exactly.
Okay.
Of course, you have your associates, the clinic, your dental clinic from different specialties, but it's not the kind of clinic I would personally wish to work in. So I needed to go on my own. That was very difficult because none from my family was a dentist. So
no one from your family was in healthcare or anything?
No.
Okay.
So I had to start from scratch.
Right.
That was both interesting and difficult. But
Here you are.
here I am.
But so, I asked you this question is because when people enter dentistry, dental students who have entered dentistry, what would your advice be for them? People who are into first year of DDS or second year of DDS, what would your advice be for them?
I would advise them to realize that dentistry is a much more interesting and wider science than we initially think.
Okay.
I said before that we dentists need to deal with many things at the same time.
Right.
And a general practitioner has to deal with very difficult issues. We spoke before about sports dentistry, but we find difficult issues every day in our office. We have all the tools available today from technological point of view to protocols. And I think this is a very interesting science for somebody to follow. I would recommend students to follow dentistry.
Okay. Because that was my follow-up question is if there are students out there or they're in high school and they want to make dentistry their career, should they become a dentist? Would say like back in home in Greece, because you travel to a lot of countries, you travel to a lot of different continents, you see dentistry being practiced different ways and at different levels.
Yes.
So do you think that is dentistry a good career to choose for a student out there in 2024?
Yes, I really believe so.
Okay.
And I believe also the best way to practice dentistry, because you said from where somebody could come from, I think it would be nice somebody to have dental studies somewhere and then go back home and work there if he wishes.
Giving back to the society.
Yes, and the world we're living in today, you can have interaction from all over the world.
Absolutely, and we are a good example of that.
We are a very good example.
Exactly.
So it's you always learn. You meet people from different countries. You see what they do in their countries. You get ideas. You try to implement your ideas back home in your office, and this is amazing.
Absolutely. I mean, we are at a sports dentistry conference, but the lectures are also about other aspects of dentistry.
Yes.
And I'm getting to learn a lot of different things, which I can go and implement in my general dentistry, not just sports dentistry, which is great. I mean, that's not what I had signed up for, but I'm getting that. And
Yes.
I mean, that's much more than what I expected.
Exactly. This is the third international symposium we organize, and all 3 times I was involved in making the scientific program. So when we, for example, here in Edinburgh, before Edinburgh, we elaborated the scientific program, the topics, the speakers. But I have to tell you that I'm watching all the speeches and all the lectures because I learn from every lecture. I learn new things.
Right.
So for me, it's very educating, all this.
So, going back to a little bit about Greece,
Yes.
because that's one country which I really want to visit once. So
You're welcome
absolutely,
to visit anytime.
Definitely, Athens is on
We
my.
can do the same thing in Greece with a different background.
Definitely. So my question to you is, one thing you like about Greece and one thing you don't like about Greece. Can be about dentistry, can be about general life. That's your pick.
There are many things I like about Greece, and there are many things I don't like about Greece.
But dog, just one.
It's not just one. That's a hard pick.
Yeah.
One thing I like about Greece is the beauty of the country.
Okay.
I think it's the most beautiful place on earth. This is what I like: the weather, the sun, the sea. It's amazing. I have visited a lot of places. I believe it's the most beautiful one.
Absolutely. I mean, you have traveled, because I keep seeing your stories, and every month you're in a different country, different continent, and then after traveling everywhere, if you still say Greece is that pretty, I mean, it has to be that pretty.
It is pretty. Maybe I'm saying this because I'm from Greece, but you come to Greece and you tell me after. Okay.
Okay, done.
Then I will ask the questions when you come to Greece. Okay.
Done, doc.
So one thing I don't like about Greece is that I realize that many times Greeks do not see their potential, the real potential.
Potential in what?
In everything.
In everything. Okay.
There is a great potential in people, in all the areas, from organization to decision making to policies. And I think many times we Greeks underestimate ourselves. We can do better in many sections.
Okay.
If you ask me something more specific, because I'm a sports dentist, I am in, let's say, in the world of sports.
Say sports, yeah, exactly.
It's really very sad to see that we have still in Greece the phenomenon of violence in sports.
Okay.
In venues.
The hooliganism.
The hooliganism, as we say. And this is really something that hurts me a lot. I've been visited a few years ago in an international conference, the Isokinetic, in Barcelona, in the Camp Nou. Huge and amazing stadium.
You mentioned yesterday that you're a Real Madrid fan, and
yes, but I give my respect to Barcelona. This is not just a team. This is a whole thing.
Institution.
So I was amazed by the stadium, and they were giving us a tour in the stadium, and they told us that it's in every game of Barcelona, FC is full, and you can see families with the babies going in the stadium, eating, drinking, enjoying the spectacle, and seeing the game. This you don't see very often in Greece.
Okay.
And
that's something which you would like to change.
Exactly. I mean, we need to have safe stadiums without any violence problems, so that everybody can take the baby or somebody and to go to the stadium.
But do you think the situation is improving?
It is improving, yes.
Okay.
It is improving.
Then it's great.
I'm optimistic. I believe that it's improving, yes.
Okay. So we'll come to our last part, which is sports dentistry again.
Again.
Where do you see sports dentistry heading in, say, like the next couple of years? Where do you see it going? Say Greece specifically and worldwide in general.
I believe that over the next 3 to 5 years, sports dentistry will be directed more in academic level.
Okay.
I see more and more dental faculties being interested about sports dentistry, and I see more and more dental faculties around the world
Okay.
starting to organize courses of sports dentistry and even Master of Science programs, postgraduate programs on sports dentistry. I do believe that over the next 5 years, more and more dental faculties will bring sports dentistry into the academic level where it's supposed to be.
Right.
The second thing, I believe that over the next 5 years, sports dentistry will be integrated more in the world of sports in terms of teams in all sports. I want to see, and I believe I will see, we're all gonna see
that's supposed
more dentists be involved in the medical team, and not only on the teams, but also on the medical committees of sports federations. This is where the decisions are made.
That's what we spoke yesterday
Exactly.
about. Yeah.
So I believe over the next 5 years, those are the two things that we're going to see in sports dentistry.
Wow. I mean, it looks very bright. It was a struggle initially. It is a struggle right now also. But I'm in this field since the last 3 years now, and I'm seeing the work you guys are doing, and of course, yes, it does look promising, and I hope what you say comes to reality. But my only concern, Doc, was things have to even the sports clubs, sports administrators have to also start respecting sport, because like we have a sports doctor, a sports nutritionist, a sports physio. It's high time we get a sports dentist too in the team. And
yes, of course, this is the big challenge, and as you said, it's going to be a struggle. It will be a struggle also, but that's the beauty of it. I said at the beginning that we learn things from sports, and this is the next level to compete as sports dentistry. And especially when I see people participating in sports dentistry, like I see people coming from all over the world here in Edinburgh. This makes me very optimistic that in 5 years we'll do the same.
Absolutely. In a much bigger,
maybe. I'm very optimistic that we will have better results. It's another game, it's another league from now on, and we're looking forward for the challenge.
And rightly said, I'm very optimistic about sports dentistry. It requires the right people, the right efforts, which I think is happening now. And like I said, you are at a very high level position where you can make things change. And I hope you do that, continue doing that, and keep making things better for sports dentists across the world. And I hope to see you in India soon.
Me too.
Because, like I said, have you been to India?
No.
Perfect.
Now I have another reason to visit India.
Absolutely. And there are a lot of sports dentists there, a lot of sports teams there.
I know.
There are a lot of cricketers there, a lot of football. And India is upcoming in sports.
Yes.
And the need for a sports dentist will also increase, as like Greece. And thank you, Doc. It was. Anything which you.
Yes.
Sure.
Since you mentioned India, I've never been in India.
Okay.
But I'm sure I will.
Absolutely.
Come one day.
Would love to host you.
Now I said I have another reason, but I do have a lot of friends. I did make a lot of friends in India, dentists and sports dentists. And I have to tell you that I'm very, very amazed. It's amazing how sports dentistry develops in India. I know that the Indian Dental Association is having attention on sports dentistry.
Right.
I know they support sports dentistry, and I see the curricula developing there and the educational programs about sports dentistry. And there are many, many times, because I see this watching my friends in social media and in internet, and it makes me think, I want to grab the plane and go and visit them. But I think it starts to be a great work also in India, and I'm very, very happy about that.
And like I said, there are times where I'm at a sports tournament and you have messaged me saying, great job and well done.
Yes.
And that motivates us.
Yes.
Because, it's not the validation we need. It's just that, there's someone out there in different part of the world,
Yes.
appreciating what we're doing.
Exactly.
Because back home, it's still a very small upcoming field.
Yes.
And like I said, with you at the helm, sports dentistry is in the right hands. And
it's I will say again, we have an amazing team. Then we're doing amazing teamwork.
Right.
And it's a great value that we come from different countries, from India, from Greece, from Paraguay, from France, from Norway, from many different countries, and this is something great.
A lot of South American sports dentists message me, seeing the story, saying we wish, say hi to Dr. Thanos.
Yes.
We wish we were there, but we could not because of their travel issues. But like I said, you need to take it globally now. You need to take the association. You need to take the conferences globally. It's high time.
Yes, this is our next goal, and I do believe that we can do it. Because as you mentioned, the same way I'm speaking with you, you are in India, the same. I have a lot of friends in South America.
Right.
That we constantly in communication, and this makes things easier.
And I think that's the beauty about sports dentistry.
Yes.
You connect with a lot of dentists worldwide through sports.
Yes.
And if you're passionate, if you love it,
Exactly.
there's nothing better in the world right now.
Yes.
So, it was a very short podcast, Dr. Thanos. Thank you for your time. I know you're super busy with all the arrangements and even your lecturing. So, but hopefully we'll have a bigger setup. We'll have a proper podcast, proper equipment. And once you're in India, I'm in Greece or anywhere in the part of the world, we'll have a much bigger, because you have I know you have a lot of knowledge and experience which you would like to share with the upcoming generation, which we also would love to hear from you. And due to time constraints right now, I'm not complaining about the location. I'm just we could do it in a much bigger scale, hopefully soon, Doc.
So I'm looking forward.
Absolutely. Thank you so much,
Thank
Doc.
you very much.
I'll see you.
Thank you.
Thank you. Done, Doc. So I'll just tell how to take a story of yours. I'll just tell, and that's it. And Doc, this is for you.
This for me.
It's